Good morning, Dr. Offit. Thank you for making the time to talk today.
My pleasure.
I've spoken to a lot of illuminaries, folks whose books I've read, people I look up to in the healthcare space. I don't think I've spoken to a hero in my own field in pediatrics yet, and you are that. I'm just going to start right off the bat with just a personal connection that you don't even know we have. You've done a lot of work in the vaccine space. And my dad, who's actually a pediatrician, retired pediatrician neonatologist, was afflicted with, thank God, a mild to moderate case of polio. And he's an immigrant. And so I was in a situation where growing up, due to his chronic limp and gait instability, my brothers and I, both of whom were doctors, were constantly reminded of the value of vaccines. And so, fortunately, it didn't hinder him. He had an unbelievable career, but it's something special. And then, of course, something folks don't realize when you go in and out of the ICU when you're in training and beyond, and you're at the children's hospital, you see kids who are walking on Monday that are not walking on Tuesday, kids who are breathing on Wednesday that are not breathing on Thursday. That's the stuff that doesn't make the news. And I understand it's morbid, but it is reality. And so you as a pediatric infectious disease doctor, and I think inarguably, as far as I'm concerned, leading voice on vaccines. And when I say leading voice, when I read your books and I've heard you speak, it's that combination of, yes, clinical bench research, expertise, heads down, combined with practical clinical applications, right? That's a rare combination. You've done it at the highest level. Your CV is way too long. Usually I don't have to read someone's CV. I can talk about the 3 things they've done. You're the director of the Vaccine Education Center and professor of pediatrics in the Division of Infectious Diseases at the Children's Hospital of Philadelphia. Anybody who knows anything about pediatrics knows CHOP, the Children's Hospital of Philadelphia, is like the Mecca. It's the place we kind of, that's our church as pediatricians. Internationally recognized as an expert in the field of virology, immunology, and a member of the advisory committee on immunization practices to the Center for Disease Control and Prevention. And I know there's a lot of politics going on there now, but you've held a lot of positions where you've advised major government organizations. You've written over 10 books. Most of the books, I don't want to list all the books, but most of the books speak to the disinformation or misunderstandings around vaccines, right? And they're very cerebral. And when you communicate in your writing, or when I've heard you speak to folks, sometimes in more peaceful interviews, sometimes in less peaceful interviews, I find you to be very practical. I find you to be compelling. I personally do not find you to be dogmatic. And I've actually absorbed much of your style when I deal with our patients. And I find that when patients feel heard, then they're willing to listen themselves. And I notice I've really learned a lot from you. You've never taught me directly, but you've been a professor in pediatrics to me indirectly, if that makes any sense. And so long-winded way to say it's a privilege and an honor to speak to, I think, the strongest mind in understanding the importance of vaccines. And so that's the intro. I do have the way I wanted to have this conversation, Dr. Offit, I wanted to have a conversation the way I actually think the average American patient would have the conversation, okay? And I'm not talking about folks that are in extremes. Most people are not extreme. The extremes obviously have the loudest voices, right? Because people who are in the middle tend to listen because they don't have, a dogmatic view. But the one person in the room out of 10 who feels strongly is going to sound like they're, the majority when they're not. And so I wanted to have the conversation the way most people I know, I think, would want to have this conversation. And I want to tee it up at a high level. Something I've observed, and I haven't heard you speak to this point specifically, it's kind of a socio-political point. I'm really interested to hear your view. I feel that the reason today when I practice, I'm still practicing, I practice 7 days a week. The reason when I go in, I have families who are on their 3rd child. They fully vaccinated their first 2. They have Samantha's 10 years old, Jimmy's 8 years old, and they just had their 3rd. And Jimmy and Samantha were vaccinated, and the family's coming in and saying, Dr. Baker, I'm not anti-vax. Look, we vaccinated Jimmy and Sam, but now I want to space them out. And they start mumbling and jumbling, and they don't know what they want. They don't realize they don't know what they want. They just don't want what's out there, which tells you that this delta between, trust in us as doctors and the healthcare system and, being able to affect our patients is really at an all-time high, right? The distrust in us as doctors in the healthcare system as an all-time high. I've never seen, my dad, like I mentioned, he's a doctor. He used to joke, 25 years ago, if a pediatrician said, listen, I need you to do jumping jacks and then, jump out the window so that his cough goes away, the parents say, yes, doctor, right? Like there was no questioning it. He would show up after running to 2 hospitals for deliveries 3 hours late, patients in the waiting room. There was no complaining. They're just thrilled that the doctor's there. Now, forget about it, right? Now they come in and you're at best a third opinion by the time the patient's seeing you, between ChatGPT and their cousin Susie, who's an NP in Los Angeles. And that's fine. That's the reality we're in, and more information can be good, depending. And so I'd like to hear you with your breadth of experience. Why do you think there's this massive distrust in us more than ever before as doctors and healthcare professionals?
I think it's a consequence of the first 2 years of the pandemic. I think that really turbocharged this mistrust for a couple of reasons. Actually, Robert F. Kennedy Jr. said it, and I agree with him. He said, I am here as Secretary of Health and Human Services because of this pandemic, because he frankly has disdain for the agencies he heads, CDC, NIH, FDA, and he represents at least a portion of the public. I mean, in the first year of the pandemic, in 2020, when the virus SARS-CoV-2 came into the United States and started killing people, we didn't have anything. We didn't have antivirals till October. We didn't have monoclonals till November. We didn't have vaccines till December to try and prevent a virus that was spread asymptomatically and could kill you. And so all we did was try and prevent human-to-human contact, which means shuttering schools, closing businesses, restricting travel, masking, isolating, social distancing, quarantining, testing. And I think people saw that as massive government overreach, especially regarding how long we closed schools, which was longer than we needed to, and for how long we closed businesses, which I think was longer than we needed to. And more importantly, that it was done in this top-down way, that we just dictated that that's what you're going to do without including members of the business community or the educational community. So I think that was punch number one. Punch number two was when we did have vaccines by December of 2020, and then they were much more readily available in 2021. You couldn't go anywhere without your vaccine card. You couldn't go to your favorite bar, restaurant, sporting event. You may be fired from your work. Couldn't go to your place of worship. And I think people also saw that as massive government overreach. And even, for example, people who were naturally infected, who then were sort of compelled to get vaccines to stay at work, argued reasonably, wait, I've been infected, aren't I also protected? Perfectly reasonable thing to say, yet some of them were still fired from work. And I think we leaned into this libertarian left hook, and I think we're feeling the punch, which is, you know what, I don't trust you. I'm going to do what I think is best for me. And it really kind of charged this medical freedom movement, which in many ways is at variance with public health.
Yeah, and then before we leave that point, I have 2 questions on that. I agree that what happened in the pandemic and we as healthcare professionals, how we handled it maybe caused an increased hesitance in the trust that's critical to being able to do what we do, which is help and save lives. I agree with that. But Dr. Offit, has there been other things either before or after the pandemic, do you think, that are happening there that are kind of also causing that decrease in trust? Question 1, and question 2, and you could answer them together if you'd like, is how specifically, I think you did a good job of laying out the overreach, the top down, the lack of pragmatism from folks making decisions like, I got infected, can we talk about this? Do I need the 8th vaccine? Can you talk about how maybe next time this happens, or how if we could go back, we could have done a better job just so we could take away some learnings as healthcare professionals?
I do think we should have explained ourselves better. And in some ways, regarding the vaccine, we oversold that vaccine. I mean, when I was on the FDA's Vaccine Advisory Committee in December 2020, when we considered Pfizer and Moderna's vaccine, and if you looked at those data, both Pfizer and Moderna had 95% efficacy against all manner of symptomatic illness, mild, moderate, severe. There's no way that was going to last for mild or moderate illness. I mean, SARS-CoV-2, like flu, like respiratory syncytial virus, like rotavirus, are short incubation period mucosal infections. The goal of those vaccines is to keep you out of the hospital, keep you out of the intensive care unit, and keep you from dying. You're not going to protect against mild to moderate disease 6 months after you've been naturally infected or vaccinated. And so the reason that those data were so amazing was that those were 3-month studies. I mean, those subjects had just gotten their second dose. That's why they still were all well protected against mild to moderate disease. And I think we failed to say right at the beginning, here's the goal of this vaccine. Because what ended up happening is people were saying we're compelled to get a vaccine, mandated to get a vaccine, and then they got a moderate illness, which is not trivial. You could still be home for a couple of days, chills, fever, and people are saying, they made me get this vaccine and I'm still sick. They lied to me. And I think the CDC was also a participant in this, and it happened in July of 2021 when there was a thousands of men get together, go to Barnstable County, Massachusetts, Provincetown, Massachusetts, to celebrate the July 4th holiday. 342 had been vaccinated and nonetheless developed either an asymptomatic or mild or moderate or severe infection. So 4 were hospitalized. The hospitalization rate of 1.2%. That's great. That's a vaccine working well. The rest had mild or asymptomatic infection, which the CDC in their report in Morbidity and Mortality Weekly report called breakthrough infections. Bad word. Breakthrough implies failure. This wasn't a failure. It was a success, and I think we should have hailed it as a success. We didn't, because we were so interested in making sure everybody got vaccinated, we oversold it. And, like this virus is just going to bounce right off you if you've been vaccinated, that you're not going to transmit the virus to somebody else. You have a lesser chance of transmitting it, but you don't eliminate transmission, because that's the nature of this infection. And we didn't explain that. And I think people got disappointed and angry. And there also in August, I remember, of 2021, when President Biden stood up and said, as of September, we are going to offer a third dose. Like, Omicron hadn't come into this country yet. It didn't make sense. And so we, again, FDA Vaccine Advisory Committee, reviewed those data in September and said no. And the CDC Advisory Committee, when we actually still had a CDC Advisory Committee, also said no. And so now people are confused. Wait, they're saying you need a third dose. Now they're saying you don't need a third dose. And it was confusing.
Yeah, I agree. I think we could have been more measured, right? I think we just kind of overshot. And I do think it came largely from a good place, right? But it was a lot coming at us at once. The healthcare community was doing the best it can. Could have been done better. I just hope that we extract, like what you kind of elucidated, those learnings, because this won't be the last time something like this happens. So we just need to be better for it. I wanted to, Dr. Offit, I wanted to now now we have the context of, okay, more than ever, patients don't trust guys like me and you, right? That's where we're at today. And, in an odd way, more than ever, people need us. There's higher rates of chronic disease. There's life expectancy drops in the United States, sometimes 3 years in a row. It's kind of stabilized, ranging from opioid epidemic, young deaths that we never experienced before, increased cardiovascular disease, cancer is on the rise for a plethora of reasons, lifestyle not the least. And so not only when it comes to your specialty, infectious disease, but in general, lifestyle decisions, people are also going away from us. They're going to Fitbit or Oura Rings or Whoop to track metrics that you and I weren't trained on, heart rate variability and all. Then they're going to supplements and peptides and infusions that you and I were not trained on. And look, I tend to be very humble. You and I know the statistics that somewhere around 30% of what we learned when we graduate medical school is altered or null and void. And I think the best doctors are the most humble, not the ones that go around saying they know everything. But at the same time, while that statistic is true, it's also true that 95% of the stuff that comes also goes, and it's just a healthcare fad. And so our job is to kind of co-pilot with our patients these realities. And so patients are not just not coming to doctors for vaccines, but they're not coming to doctors for weight solutions, right? They want maybe direct pharmaceutical or outside the traditional realm, infusions, vitamins, peptides. I don't think it's all bad. I think it's this kind of avalanche coming at doctors. Some doctors are studying longevity. At our practice, we are studying it very, very carefully. We're not jumping into the water with both feet. We're looking at the data. We have a medical director who spends a lot of time on this, and we're learning. There's probably a there. There's probably some stuff that can be beneficial, but not just everything that has 3 letters and a hyphen and 2 numbers and says peptide means it's going to be good for you. And God only knows what kind of side effects are happening. We won't know right away. And so just this massive kind of tear away from doctors and healthcare, while patients are actually more into their wellness in some ways than ever before, right? It's actually rather unfortunate and sad. People are now focused on working out and wellness and health more than ever before, but they kind of don't want our help more than ever before. And so now that we've set that context, I want to take that and come into the exam room with me. Like today at 2 p.m., it's 8 a.m. right now, and we're both in the Northeast. But today at 2 p.m., I'm going to go see patients. And without question, I'm going to be in an exam room where a patient comes in and they delivered a newborn, and they delivered at Mount Sinai, or they delivered at Lenox Hill, and they're going to say, Dr. Baker, here's the discharge summary. I'm going to look at the discharge summary, and it's going to say hepatitis B deferred, right? And I'm going to be like, okay, so you guys, did you want the Hep B today? What's the story exactly? Well, Dr. Baker, we're not anti-vax, but when it comes to the Hep B, we looked at the risk factors, and my OB checked me for Hep B, and I don't know that I need it. And you could take this, Dr. Offit, however you want. You could speak specifically about some vaccines like the Hep B, but my broader question on this one, with this setup, is when patients come in and they want modified, I don't want Jimmy to get 4 vaccines at once or 3 vaccines at once, or I want the pentacyl split into single antigen. And Dr. Baker, I'm willing to come back 2 more times in between this visit and next to get the vaccines, but I don't want to overwhelm his system. Now, you and I, our minds are full of scientific data that tells us, I don't want to use the word ridiculous, but how unscientific that sentiment is, right? But then I think about the conversation we just had, where we kind of didn't listen to the community with what we went through in COVID. And I want to know what you think is the best way to approach those conversations where patients have kind of a climax of hesitancy, but you don't want to burn that bridge.
Yeah, so I'm sympathetic to people being skeptical or resistant in the sense that I think we ask a lot from parents in this country. I mean, when we ask parents to inoculate their children against roughly 14 different diseases in the first few years of life, which can mean as many as 25 inoculations during that time. It can mean as many as 5 shots at one time to prevent diseases most people don't see, using biological fluids most people don't understand. And the hepatitis B is a perfect example. I mean, you now have this reconfigured advisory committee for immunization practices, which should really be called the anti-vaccine committee for immunization practices. As RFK Jr. has fired the 17 people who had an expertise, who were giving us good advice, and replaced them with people who are basically like him, that don't trust science and have their own fixed, immutable beliefs. And so, and one of those is that we need to delay the birth dose of hepatitis B. So the committee met in September, had that discussion, tabled it until the next meeting, which I think is going to be the beginning of December. And they likely will recommend delaying the birth dose. And why? Because they're saying we need to maintain the public's trust, meaning that there are people out there who are concerned about getting that birth dose, which makes sense, right? Your child was just born. Now you're inoculating them with some biological fluid that people don't necessarily understand for reasons they don't understand. I mean, when people hear hepatitis B, they think, sex workers and drug abuse. And that's not true. And I'll explain why it is that the birth dose is important, even though I'm not sure you wanted me to get that specific, but this is a topic.
I actually think that'd be important, yeah.
Okay, so the hepatitis B vaccine was licensed in 1981. It was recommended as routine birth dose for anybody whose mother was tested in the first trimester as having hepatitis B infection. Why? Because if you pass through a birth canal that contains hepatitis B, which you will if the mother is infected, and you get infected in the first year of life, the first 12 months of life, you have a 90% chance of going on to develop cirrhosis or liver cancer. If you get infected between 1 and 5 years of age, you have roughly a 30% chance of developing liver cancer cirrhosis. If you get infected with hepatitis B as an adult, you have less than a 5% chance of doing that. So that is a vulnerable time, the child, number one. Number two, so then in 1982, we made that recommendation. In 1988, so 6 years later, we said, okay, we're going to include not only a birth dose for mothers when the mother's infected, but any mother who is in a high-risk category, Alaska Native, Southeast Asian immigrant. No difference. Neither of those two recommendations made a dent in hepatitis B infection. And the reason was clear in 1991 when we made a universal birth dose recommendation for everybody. At that time, there were 30,000 cases of hepatitis B in children less than 10. Children less than 10. Half of them got it from their mothers, passing through a birth canal. The other half, the other 15,000 didn't get it from their mothers. They got it from relatively casual contact with someone who had chronic hepatitis B infection, which infects millions of people in this country. And if you're infected with chronic hepatitis B, most people don't know they have chronic hepatitis B. They don't. Yet they have very high quantities of virus in their bloodstream. And so if there's just trace amounts of blood that are unseen on towels, washcloths, toothbrushes, razor blades, whatever, nail clippers, you can get hepatitis B. That's where those other 15,000 children were getting hepatitis B from. They weren't getting it because they were sex workers, and they weren't getting it because they were using intravenous drugs. They were getting it from relatively casual contact from Uncle Bob, who didn't know he had chronic hepatitis B. And remember, if you get hepatitis B in your first few years of life, you have a very high risk of developing cancer or cirrhosis. So that's why the hepatitis B was a birth dose recommendation. And with that, we virtually eliminated the disease in the less than 10-year-old. And I think well, here's what hasn't changed. There's still millions of people in this country who have hepatitis B. The other thing is that when you test for hepatitis B in the first trimester, that doesn't mean the mother can't get infected in the second or third trimester. Also, the test, not like all tests, is not infallible. So it has about a 5% false negative rate. 5% falsely reassuring rate. And because there's so much at stake here, to wait is to take an unnecessary risk. The vaccine is no safer if you get it at 1 month or 2 months of age. And it's certainly no more effective. If anything, it's less effective. So why wait? But I do understand it. It's like the first scratch on a new car, right? Here, your child's just born and you're inoculating for something that's preventing a sexually transmitted disease or a disease used by drug users, which is, first of all, not true, even though President Trump just said the same thing. He said we should wait till 12 years of age to get that vaccine. Rand Paul said the same thing. Why am I getting this vaccine for a child who's not going to be a drug user or
who's a doctor?
Who's an ophthalmologist, who went to medical school, so no excuses. But and so that's the hill to climb. So see, to me, you're in a more difficult position than me because I don't see outpatients. I mean, I see inpatients at Children's Hospital Philadelphia, but not outpatients. So I think you're an advocate. My wife is in private practice pediatrics, so I watch her go through this. You're an advocate for the child. I mean, that's who you're an advocate for. And so, but obviously the parent has to be convinced that it's the right thing to do. And I think, it's the notion that vaccines in any way sort of are too many, that's overwhelming your immune system or weakening your immune system or setting you up for chronic disease. I mean, when you're in the womb, for the most part, you're in a sterile environment. When you enter the birth canal in the world, you're not, and you have trillions of bacteria living on the surface of your nose, throat, intestine, skin, to which you make an immune response. And if you add up the total number of immunological components, meaning viral proteins, bacterial proteins, that you get in vaccines, it's about 170. That's actually fewer than the one vaccine we got 100 years ago, which was the smallpox vaccine, which was the largest of the mammalian viruses and had 200 immunological components. We actually have a lesser immunological challenge today from vaccines than we did 100 years ago, but it's hard to watch children get so many shots. But it's not the number of shots that matter, it's what's in the shots that matter. And I don't know, it's really hard because, parents, I'm completely sympathetic to this. So all you can do, I think, is be compelling and compassionate and passionate about why it's important. But you don't want to lose the interaction, because if you lose the interaction, if they've completely distanced themselves from you, then you've lost any chance to have a positive effect for that child.
Yeah, and that last point, Dr. Offit, I'd be curious about your advice in the community of private practice pediatrics, and often, like I look at my career the past 16 years or so, the American Academy of Pediatrics has had but there's been oscillating positions on their recommendations on what guys like me should do when a patient says, hey, I don't want to get today's vaccines, in terms of discharging them from the practice or not. And I remember when I started, the language was more, it's kind of like the circumcision. A lot of these guidelines are fluid, where I remember the language was like, hey, you know what? Something along the lines of, this is like when I was in residency. if they don't want to get the vaccines, then you shouldn't take care of them. And then if all the pediatricians aren't taking care of patient X, then they're going to end up coming back to you. And then it softened a little bit. And the language went to something like you should engage and continually educate and work with them without saying accept it, like kind of the language wishy-washy. And the result is the last statistic I saw, and I see this in the community, something like more than half, call it 60 to 70%, maybe you know this better than me, but 60 to 70% of pediatric practices will not allow you to be a part of their practice if you don't abide strictly by the CDC, schedule. Then there's, a third of practices, give or take, that will work with the family, quote unquote. Will say, okay, look, as long as we can kind of figure something out together and we're headed in the right direction. My practice has fallen in that bucket because I guess I just don't. Two things I would say, and I'm really looking for like almost mentoring on this. The way I look at it is, I almost, when you talk about being the advocate for the child, pediatrics is the only place where, as doctors, we're getting secondhand and sometimes third-hand information about our patient, right? My brother's an adult primary care doctor. When he sees a patient, he tells him, hey, I'm having rectal bleeding for 3 days and it hurts here. There's not so much investigation up front. With us, oftentimes our kids can't talk, our patients can't talk, right? They're just like lifting up their legs and they have a bit of a fever and it could be anything, right? They're not directing us anyway. And then when you put in the fact that their interpreter, we have a built-in interpreter who really doesn't know what the patient's feeling necessarily, they know better than we do in the parent. And so we're playing hopscotch for information. And so I feel, Dr. Offit, that to punish a patient by not taking care of them, and maybe I'm looking at it, maybe my ethical lens is upside down, but to punish a patient by not taking care of them or discharging from my practice because their parent and I don't agree on something, I don't know how fruitful that is. And I'll say one other thing about my personal experience. I find that when I listen and I'm like, okay, look, fine, today he'll get one or whatever and come back and this, I find when I'm not confrontational with my patients, it's shocking how high, I'm talking more than 90%, a couple of visits later, come back to me, and Dr. Offit, this is the truth, they're like, hey, Dr. Baker, can I ask you something? So the first time they come in, you're a doctor, I don't trust you, blah, blah, blah. I'm here because my cousin told me you're a good doctor, blah, blah, blah. And then 2-3 visits later of me not being antagonistic with them and kind of like accommodating their modified, they're like, hey, doc, can I ask you something? Do you have any kids? Yeah, I have 2 boys. They're teenagers. Did you give them the vaccines? They got all their vaccines exactly on the schedule. Oh, yeah, okay. So what do you want to do today? And I'm telling you more than 90% that are like, hey, because now you're not just Dr. Baker that my neighbor goes to. They've seen you take care of their kid for a few months. They trust you. You're not shoving whatever down their throat. And I know this is a major departure from the stuff we studied in med school. I get it, but we're dealing with humans too. Can you just give advice to the doctors like me who are trying to navigate this and not burn bridges and still care for families?
Right. No, it's interesting you say that. My wife is a general practitioner, and when she first started out, before she was married, and before she had kids, she was always jealous of those doctors who could say what you just said, which is that, do you do it with your own children? Because that is probably one of the most compelling things you can say, because they see you as something other than a doctor. They see you as a parent, which is what they are. So she was always jealous of that. But so I don't think there's a right or wrong to this. I think it's what the style you're comfortable with. I've watched my wife go through iterations of this, and she started off with just let me do the best I can do, and she would try and try and try, and she could get maybe about 25% of her patients by doing that to eventually get the schedule, get vaccines according to the routine schedule. And then she sort of had it, because she had a couple patients who she sent out of her office and then suffered a vaccine preventable disease and had come back, and just it broke her heart, because what she had done is she had essentially allowed that to happen. And so then she became much more passionate, and she would say, let me love your child. Please don't ask me to send this child out of this room knowing that there's still pneumococcus out there, knowing that there's influenza out there, knowing there's chickenpox out there, knowing that there's a variety of diseases which I can prevent that are out there. Because if your child comes back with one of those diseases, I can't live with myself. Please, please let me love your child. And with that, she became far more compelling. It's hard, because at some level it's really hard for us to, in any sense, be confrontational. But with that, she was much more successful. So it worked for her. And I think people have to find their own level of comfort. My personal bias is that when you dismiss them from a practice, they're going to find a practice perfectly willing not to vaccinate them, and you really haven't helped them much.
Yeah, I mean that's in summation, and I'm on this journey too. Like, I just wanted to trade war stories and just learn from somebody who's done it, better and longer. So I appreciate that. I want to ask you one or two more questions on this topic, and then I'd like to move on. Can we do, still staying with the average American patient that I see in my office, the average patient who comes in with their in that middle. I don't want to say rapid fire because some of these are complicated themes, but kind of the questions and, hey, Dr. Baker, I only got like 10 vaccines when I was a kid. Now they're getting 1 million. What's this? I'm doing fine. What's this? And I look at the patient and I don't say this. I guess the patients are going to hear what I'm thinking for the first time. I try to be more politically correct, but in my mind, I'm like, yeah. And also, when my dad, started, he used to smoke on rounds and didn't wear a seatbelt. So thank God for the advancement. We should be set. Yeah, of course we have more better science and blah, blah, blah. That's what I'm thinking in my mind. Instead, I say, I understand this is new to you, but it's not new to us in the science field and blah, blah, blah. What's your take when people have that? Hey, I'm 40 and I'm fine. I don't have any problems. I got chickenpox when I was a kid and I was fine. And of course, you and I know what chickenpox could do if it encounters a pregnant party and a neonatal infection. And even if you're old, we know all that. But you want to just give me some kind of practical tips and maybe just speak to the audience who has these very commonality hesitations.
Right. So when I was a child, there were two vaccines. I got the DTP vaccine and I got the smallpox vaccine. That was it. But I suffered from measles. Fortunately, I wasn't one of the 500 people who died. I got mumps. Fortunately, I wasn't one of those people who became deaf because it was the most common cause of acquired deafness. I got German measles, and for women who got German measles, you'd have 20,000, upwards of 20,000 cases a year of congenital birth defects of the eye, ear, or heart. I got chickenpox. Fortunately, I wasn't one of the 75 to 100 people, children primarily, who died of chickenpox every year, or the 10,000 who were hospitalized. So I guess the history is told by the survivors. And so for the person who comes in and says, look, I only had 5 vaccines and I'm fine, you were lucky. You were lucky you weren't one of those people who died from, pneumococcus or Haemophilus influenza B or meningococcus. I mean, when I was a pediatric resident in the late 1970s, and we did our emergency department rotation, which was 12 hours on, 12 hours off, I would do 2 or 3 spinal taps a night because there wasn't a Hib vaccine, there wasn't a pneumococcal vaccine, there wasn't a meningococcal vaccine. Most pediatric residents at Children's Hospital of Philadelphia have never done a spinal tap. It's the interventional radiologist that does it when you rarely need it to be done. I was very good at doing spinal taps, which tells you how bad things were back then. So, I think the problem is that it's not just that we've largely eliminated measles, which we did by the year 2000. We've eliminated the memory of measles. I think people don't remember that about 50,000 children would be hospitalized every year with measles from pneumonia, dehydration, and 1,000 would be hospitalized with encephalitis, a quarter of whom would be left blind or deaf. And we don't remember that. And that's the problem. We can be cavalier about it because we don't remember it. I mean, right now we're in the midst of the largest measles epidemic we've had in more than 30 years. We've had 3 people die of measles. That equals the total number of measles deaths over the last 25 years. We've had 2 healthy little girls, 6 and 8-year-old, die of measles, die of a preventable disease because their parents chose not to vaccinate them. That's the first child death in this country in 2003, since 2003. More than 20 years ago. This is only going to get worse. We've had about 290 children die of influenza this year. We haven't seen numbers that bad since the last pandemic, which was the swine flu pandemic in 2009. And we have 70,000 cases of whooping cough. We have states that are experiencing whooping cough deaths that haven't seen it in years. So that's where we are, because vaccines are a victim of their own success. We don't remember these diseases, and so we're very comfortable living basically this sort of life of invulnerability. We assume it's never going to happen to us until it happens to you. And if you ever listen to these sort of parent advocacy groups like Families Fighting Flu or Meningitis Angels or National Meningitis Association, those parents all tell the same story, which is basically they chose not to get a vaccine. The child then suffered or died from a vaccine preventable disease. And they say, and God bless them, I don't think I could do this, that God put me on this earth now to talk about the importance of the vaccine, to talk about the seriousness of the disease. But they all tell the same story. I can't believe this happened to me, until it happens to you. It's a dangerous game to play. It's Russian roulette with maybe 100,000 empty chambers, but it's still Russian roulette. Don't play that game.
Yeah, and to your point, Dr. Offit, I want to take that measles outbreak that we experienced, like primarily in West Texas. Earlier this year, anybody I knew who was hesitant about giving the MMR vaccine, and now their kid's 15 months old, 16 months old, 17 months old, they're putting it off. When that news hit, and by the way, in New Jersey, there was cases as well. I'm sure you know this. In Northern Jersey, there was some cases, right? I believe there was no fatalities, but there was some cases. And those same patients came banging down the door when they heard what was happening. And I was looking at them, and of course, you try to, and I'm like, well, did you think that we were just making it up? Like, did you think that it didn't exist? And what you said is actually what my father would always say. He would say, and my father's is the most optimistic guy in the world. You know how pediatricians are. He's the most optimistic guy. And sometimes he would say like a morbid thing, which was out of character. And he'd say, listen, unfortunately, I think what has to happen is, we're up here in the New York City area. He said somebody on the Upper West Side or somebody in Bergen County, a healthy 16-year-old is going to suddenly pass because of some whooping cough, or they're going to suddenly not be able to walk because of polio or whatever. And then when that community sees that, we're going to put the vaccine debate to bed for another 25 years, right? The way it was when it first, when it was thought of as a gift. And unfortunately, I think that line you made about it being a victim of its own success is extremely true. And people don't see it. Doctors see it. We're in the ICU. We see these things all the time. I wanted to shift to two more topics, and then you've been very generous with your time, and then you can enjoy your weekend. The next topic is, and I'm going to lean more on your expertise in virology and immunology, Dr. Offit. Vaccines actually being used outside of infectious disease in the traditional sense. Vaccines are now being used to prevent and or treat cancer. Cancer's, second leading cause of death. It's rising. I know it's not your core expertise, but you sure know more about it than I do. And given that people are hesitant about vaccines, but actually vaccines are being used in ways even beyond what we traditionally use to affect people's health and lifestyle and outcomes, can you opine just a little bit about kind of the frontier of vaccines?
Well, first of all, and you know this as well as I do, there are two vaccines that prevent cancer. The hepatitis B vaccine prevents liver cancer. The human papillomavirus vaccine prevents head and neck and anal and genital cancer. So we do have two cancer-preventing vaccines. But you're right. I mean, certainly the technology, especially the mRNA technology, has showed a lot of promise with being able to introduce, say, messenger RNA into cells that would then be translated to proteins, which would then make that cancer cell much more targetable for the immune response. So there's a lot of things going on now that I think are where you can both think about treating and preventing cancer using vaccine technologies. And so we'll see. I do worry under the current administration that so many of those grants are being cut back, so many of those clinical trials are being cut back. RFK Jr. just took $500 million out of the Biomedical Advanced Research Development Authority, which will just set us back. You know what? Here's just as a one pet peeve. There were a lot of heroes in this pandemic. One, arguably, was Drew Weissman and Katie Carrico, who, with their collaboration, which began in 1997, so this is 25 years ago, essentially created the mRNA technology that allowed us to use that as a vaccine. That's why they won the Nobel Prize in medicine in 2023. And Operation Warp Speed was an amazing medical or scientific advance. It really was. I mean, we were able to isolate a virus and 11 months later, have two very large clinical trials showing the vaccine worked and was safe. But another hero that nobody realizes in this pandemic, this gets to the point about RFK Jr. cutting back all these research and development funds, was NIH. Why? Because in 2002, 2003, when SARS-1 raised its head in Foshan, China, the NIH, specifically Barney Graham and others, started working on an mRNA vaccine against SARS-1. Now, that virus really never came into this country, so we never needed that. But we learned a lot about how to make it, so that when SARS-CoV-2 entered this country in February 2020, we had a lot of information. And by cutting all these research and development costs, we're losing a lot. And will put us further behind the 8 ball when the next pandemic happens. And there will be a next pandemic. There's been 3 pandemics in the last 20 years. Let's assume the next one's not far away.
Yeah, and I want to, that's very useful. I want to talk about another piece of distrust, and then we could wrap up, which is the distrust in doctors and the healthcare system, which has been the theme of our conversation this morning. And you've done a great job of kind of, meeting me and where folks are and enlightening us. I think that's eclipsed, Dr. Offit, by distrust in one other entity, which is the pharmaceutical companies, right? And so, eventually as a doctor, you generally will gain trust because you're a human and you are somebody that has a personality and a POV, and 99% of the doctors I know are good people. And so patients eventually, fall in love with their doctor, right? And they trust them and they're like, this is somebody who's here to help me and my child. And you could earn that trust. But the pharmaceutical company is not human. It's not anthropologized. It's this sterile thing that they see on a ticker on Bloomberg that, with make no mistakes, is there, and we know this, is there first and foremost to make a profit. That's what it is. Now, I think where the patients, and in this case I'll call it the patient consumer because of the lens we're looking through, where sometimes they struggle, and frankly I totally get this, is, well, if their main goal is to make a profit, why the hell do they care? Why should I trust what they're, it's possible for them to have a goal of making a profit and also do important scientific advancement that helps us. Like those two things, again, the distrust doesn't allow that kind of two thoughts in one mind thing to happen the way it should. But can you talk a little bit about, and again, back to the administration's, I can't keep up, we're anti-big pharma, and then there's a deal that it gets done with big pharma. So I've given up trying. I actually don't think they have a specific POV. I think it's an opportunistic, but I'd rather hear from somebody more cogent on this. Do you think the way pharma sits in our society, with regulations, with approval processes, do you think there's room for improvement in that process, or do you think it should stay as is?
No, there's definitely room for improvement. I think, so here's an example. If, when you make a vaccine, you have to get it licensed by the Food and Drug Administration. So you submit your data to the Food and Drug Administration for licensure. And so then when I was on the FDA Vaccine Advisory Committee, you would get 200 pages from the company about their trials, and then you would get 200 pages from the FDA, making sure there were no omissions or misrepresentations when they went through all the data. So now let's suppose the company did lie and did misrepresent things. And now the vaccine is out. There's no hiding. I mean, the vaccine safety data link is looking at children who did or didn't get that vaccine in real time and quickly. And if there's a side effect, you'll find it. So there's no hiding. You can lie, but you're not going to be able to lie for very long. So I think the vaccine world, with things like the vaccine safety data link, which is this linked computerized medical record system of roughly 10% of the U.S. population, including about 500,000 children, you can very quickly know whether there's a safety problem. I wish that existed on the drug side. I wish there was a drug safety data link. So when Vioxx, for example, came out and was found to be a rare cause of heart attack, you could have picked that up much more quickly. And I think that there could be better supervision on the drug side. I think maybe it's on the vaccine side because we give vaccines to healthy young children, so we want to make sure it's held to a high standard of safety. But certainly that's true. And I think the opioid crisis, I think, is an example of the pharmaceutical company at its absolute worst. I think it was corporate capture in many ways of the FDA, and everybody looks to that as an example of why it is you should never trust pharmaceutical companies. But the fact of the matter is, only pharmaceutical companies have the resources and expertise to make the drugs and biologicals that save our lives. That's your only choice. I'm fortunate enough to be the co-inventor of the rotavirus vaccine with Sam Plotkin and Fred Clark. And so only pharmaceutical companies were going to make that as a product if it was going to be made at all. And, but the minute you do that, the minute you associate yourself with a pharmaceutical company, you're a bad guy to some people. And, pharmaceutical companies do act aggressively, unethically, and even illegally at times, but they don't always do that. And I just think, we should, try, and not that this is in any way possible, don't get me wrong, we should at some level try to humanize the people in pharmaceutical industry, because you're right, they're seen as a distant, monolithic, inhuman body. And my experience with, at least with working with Merck on the development of the rotavirus vaccine, the person who headed that program was named Penny Heaton. So she was an MD who trained in Louisville. Then she went to work as an epidemic intelligence service officer in Kenya, where she saw children die of rotavirus. And then she came back to work at Merck because she thought, okay, this is the only way that I'm going to be able to really make a difference here. And so she was in charge of that big phase 3 trial, prospective, placebo-controlled, 72,000, 11 country, probably $350 million trial that they did to show the vaccine was safe and effective. And at Merck, it was Merck Upper Gwynedd. So she's presenting those data. So here's 200 people in the room. So she shows a map of the world. She shows that the vaccine in this big trial was safe and effective. Then she shows a map of the world, which is studded with little black dots. Each black dot represents 1,000 deaths from rotavirus, a virus that killed 500,000 people in the world every year. And then she primarily Southeast Asia, Africa, Latin America. Then she shows a map of the world where all those black dots are gone. And she says, now we have a chance to eliminate all this. And then she puts her head down and weeps, shoulders shaking, weeps. That is not an image anyone has of a pharmaceutical company because they don't want to have it. They want to see them as evil. But when people say, well, pharmaceutical companies say this, but the parents say this, pharmaceutical company people are parents, just like doctors are parents. And I think it's an unfair divide.
That's I didn't contemplate that, and the way you humanized it. I actually know a lot of people who work in pharma, and I know a lot of PhDs and scientists that do the heads down work, and obviously the people producing these products themselves, what people forget are, utterly altruistic. Right? Now, it might get to the marketing, the chief marketing, I don't want to get specific, to a person who really has very little to do with the pharma that might manipulate or whatever, and even that happens rarely. But yeah, of course, these people went into it for the right reasons. Generally, the 99% of the people that make up this industry, and that's saved countless lives. And then we'll close, because this was an incredible talk. I learned a lot, so I'm sure anybody who's going to consume this is going to learn a ton. And I want to thank you for your time, Dr. Offit, again. And I really do hope we could continue a conversation down the line, because God knows this theme is not ending anytime soon. And I think there's going to be, unfortunately, more questions than answers in the immediate future. Dr. Offit, I'm a 47-year-old guy from Jersey, right? I grew up, Hudson and Bergen County. I love basketball. I like steak. I'm a regular guy, by day kind of thing. I listen to really popular podcasts like the average guy my age does, right? The Joe Rogan podcasts, the Huberman podcasts, whatever, okay? Sometimes, and they have different folks on who talk about topics like this, and none of them come close to your expertise, knowledge. Some of them are good at articulation, but the substance isn't there, right? And they compensate with, what's it called? The silver tongue. What is it that holds you back, or what is the calculus that I think prevents you from wanting to engage sometimes in probably unfair circumstances where you'd be disadvantaged for sure, but given the importance of what you have to say and, and frankly, not only the importance we have to say, but the time we're in where, we really need this voice to be out loud. What's your view on kind of having those, I'll call them debates, and I know they won't be, done properly, and that's a disadvantage you would have to be willing to live with. Can you just give 2 cents on it? Because I'm always hoping when I go to Spotify and I check out one of these big popular podcasts that, hundreds of millions of people consume, that I'll see your name on it so that truth can be spread.
Right. So I've been asked to debate Robert F. Kennedy Jr. by people who were representing him, and they offered money for me to debate him, like $50,000 to debate him. But see, I guess although I'm trained as a pediatrician, my functional life was really as a virologist, and so I did studies, worked on rotavirus, trying to understand that virus. What part of the virus made you sick? What part of the virus induced an immune response that protected you? And so we would have annual meetings, these so-called double-stranded RNA virus meetings, and we would debate. Because we all were generating data, and we all were interpreting data in a way we thought was correct, and we were curious about how other people's interpreted their data. And there were lively discussions about how to interpret those data. And I love that. It's how I learned. It's how my science got better. But to debate Robert F. Kennedy Jr., all you're going to be doing is saying, well, that's not true. I mean, if he argues that the measles, mumps, rubella vaccine caused autism, you would say, well, here's 24 studies done in 7 countries on 3 continents over the past 10 years or 20 years showing that it doesn't. Well, I don't believe that because those people are all in the pocket of the pharmaceutical industry. That's not a debate. It's just, you might as well debate whether or not birds are real. It's just, which you could debate. Somebody could say, well, birds aren't real because they're robotics. Well, how do you know they're robotic? Because when I cut them open, the heart's beating. Well, they're really good at robotics. Where are they made? They're made in China. Well, okay, show me where they're made in China. Well, they keep moving where they're being made. I mean, just, you could successfully debate whether or not birds are real. And I just feel that that's true here too. I don't think it advances things, is what I'm saying. The one thing I did do, I was on, it was Amy Goodman's show called Democracy Now! And there was
Great
an
show.
anti-vaccine. Yeah, so I like Amy Goodman. She wanted to have Mary Holland on, who's now the president of Children's Health Defense, which is Robert F. Kennedy Jr.'s anti-vaccine organization. They wanted me to debate her, and I didn't want to do that, but I said I would follow her. Let her say what she wants to say, then I'll say what I want to say, and that was fine. I mean, when she would say something, I would write down. She said hepatitis B vaccine, causes autism in boys. She said so. I would sort of write those things down. Then it was my turn. I sort of went through where I thought she was wrong. And I did get a lot of positive emails from people saying, thank you, that helped me. That helped me to talk to my patients or whatever, or friends or whatever. But I just think if you get into this sort of match where you're talking to somebody and you're just not hitting on anything that's common ground, I just think people remember the fight far more than they remember the facts. They don't know who the expert is. I'm not sure what anything is learned. It's like crossfire. People like the tension, but I don't think anything's learned. But also, I don't think I have the temperament for it. I mean, I watch certain people like Joe Schwartz in Canada, or Bill Nye, who's willing to get up there with science denialists, and he's very patient and he just goes through it. I get angry too quickly. It's my problem.
No, I hear you. I get it. I'm with you. I hope, I don't know, as like a doctor and like a pediatrician, frankly, who deals with this day to day, the folks come into the office and they just listen to this podcast, read this article, and when you think about the sources of information they're getting and how unexpertise they are, you would hope that there was they consumed a little bit of the voice, a voice like yours. And this is where you would say, Z, that's your job. That's what they're paying you for too, and I get that. But they come in so already preloaded with this misinformation that we're not even starting on equal footing in the doctor-patient relationship. We're having to spend more time not educating, but first disentangling misinformation just to get them here and then start to educate, right? Whereas in my dad's days as a pediatrician, patient came in at ground zero. They didn't have a POV, so you would just educate them. Again, this is not to say that the doctor has, proprietary knowledge of all the right answers. So very, very, very far from it, right? But in terms of having, this relationship with patients where there's trust and then we build together, I think we need a voice like yours to be just a little bit louder. And so, yeah, I get it. And the temperament thing, I'm a victim of it too, believe me. So I totally empathize with that. And we're coming upon an hour, Dr. Offit. I want to thank you again for spending this time. This was a great, great conversation. And I really do hope you'd allow me to kind of, contact you in the future when things are happening out there and lean on you for your expertise. Thank you so much for all the work you've done.
My pleasure. Good luck to you.
Thanks. Appreciate it.